Welcome to my YouTube channel. They'll be talking today about the many ways that medicines can be taken. There are numerous methods for delivering medication to the patient. Both the drug and the individual patient play a role in determining the best administration method. The chosen path is determined by practicality, convenience, and common sense. There are two main types of routes. First and foremost, activities in the immediate area, and also the second, a methodical approach. Let's talk in broad strokes about these classes. Known routes within a given region. These access points are only appropriate for small localized lesions. At convenient locations, and only for drugs that are poorly or not at all absorbed systemically when taken in this manner. This allows for highly concentrated levels at the treatment site without systemic side effects. As a result, there is either no or very little risk of systemic adverse effects or toxicity. Glyceryltrinitrate, GTN, applied topically as an ointment or transdermal patch, is an example of a drug that can be administered systemically via absorption through these sites/routes. Here are the local highways. First place, on topic. This means putting the medicine on the skin for a targeted effect. Lotions, ointments, creams, powders, rinses, paints, drops, sprays, lozenges, suppositories, and pessaries are all effective drug delivery methods for localized lesions on the skin, oropharyngeal or nasal mucosa, eyes, ear canal, anal canal, and vagina. More subcutaneous fat intra-articular injections, such as hydrocortisone acetate in the knee joint, infiltrations around nerves or intrathecal injections, such as lidocaine, and retrobulbar injections, such as hydrocortisone acetate behind the eyeball, are all examples of deep areas that can be reached with a syringe and needle. Third, the availability of arterial blood. Contrast media in angiography is injected directly into an artery, and anti-cancer drugs can be infused into an artery in the limb to target the cancer only there. Now, methodical way. The goal of a systemic route of administration is for the drug to be absorbed into the bloodstream and circulated everywhere, including to the site of action. A systemic approach is. The first option is the oral one. Drugs have traditionally and most frequently been taken by mouth. It's less expensive, less time-consuming, less invasive, less painful, and doesn't require a sterile environment for the medication. Oral administration is possible with both solid and liquid dosage forms, including powders, tablets, capsules, spansules, dragees, molded tablets, gastrointestinal therapeutic systems, GITs and elixirs, syrups, emulsions, and mixtures. Second, you can try the sublingual route. The drug is administered by placing the tablet or pellet under the tongue or crushing it and smearing it across the buccal mucosa. Drugs must be lipid-soluble and non-irritating in order to be given in this manner. Actions can be seen in as little as a few minutes after absorption. The drug can be spit out once the desired effect has been achieved, which is a minor inconvenience. The main benefit is that drugs that require extensive first-pass metabolism in the liver can be absorbed directly into the bloodstream. GTN, buprenorphine, and desamino-oxytocin are all drugs that can be taken sublingually. The third, suppositories or a retention enema placed in the rectum can have a systemic effect, despite the fact that they are irritating and unpleasant. This route is also appropriate for patients who are unconscious or who are vomiting repeatedly. Although diazepam solution and paracetamol suppository are rapidly and reliably absorbed from the rectum in children, it is rather inconvenient and embarrassing because absorption is slower, irregular, and often unpredictable. Exit point 4. the skin. Drugs that are highly lipid soluble can be absorbed slowly and steadily when applied to the skin. Also avoided is the liver. An ointment containing the medication can be rubbed onto the skin. Drug absorption may be improved by rubbing the preparation in, applying an oily base, or using an occlusive dressing. Inhalation is the fifth method. Inhalation is used to administer volatile liquids and gases for systemic action, such as general anesthetics. Alveoli have a large surface area for absorption, so their action is swift. When drug administration is stopped, the drug quickly returns to the air via diffusion and is eliminated in exhaled air. Therefore, moment-to-moment regulation permits controlled administration. Vapors, such as ether, that irritate the respiratory tract trigger swelling and increased mucus production. Nasal inhalation is option number 6. Many drugs are easily absorbed by the mucous membrane of the nose, skipping the digestive juices and liver. However, this administration method has only been used with a small number of drugs, primarily GnRH agonists and desmopressin in the form of a spray or nebulized solution. This strategy is being tested for the delivery of insulin and other peptide drugs, as well as for penetrating the blood-brain barrier. Subcutaneous, intramuscular, intravenous, and intradermal administration fall under the 7th category, known as the parental route. We appreciate you taking the time to view the clip. Please subscribe for further updates.